Good morning. For those of you that don't know me, my name is Art Weltman. I direct the exercise physiology program here at UVA, and I have a leadership role in the promoting health and well-being aspects of Youth-Nex. I didn't actually put together a Jeffersonian slide, but since everybody else is quoting Mr. Jefferson, he did have something to say about exercise. He did say that exercise is as necessary as reading. I'd say rather more necessary because health is worth more than learning. So I know for some of you this is an aspect of your day that you don't think about very much unless you're engaged in personal exercise. And what we want to do today is talk a little bit about incorporating physical activity in the preschool setting, in the school setting, and in the community setting. And we're fortunate enough to have engaged a very prominent panel to talk about those areas. Now, there are a lot of different areas we could have chosen to talk about. The one that's probably getting the most press right now is childhood obesity. And just by way of introduction, since we're not going to talk about that today, but everything that we talk about with respect to physical activity impacts things like obesity and cognitive function and learning. If you look at the trends in obesity since the 1970s to the mid-2000s, by definition, only 5% of children can be above the 95th percentile for their age and height for their BMI. And if you use the 1960, 1970 data as the standard, you can see that over the last 30 years or so, the incidence of childhood obesity has increased to about 20%, both in preschool and in elementary and secondary school. And it's prompted a lot of research in the area and a lot of lay literature in the area. This is a cartoon from the, is this thing on automatic? Because I'm not touching anything. It's gotten a lot of press in the lay literature. This is from Time magazine. When I first started doing this way back when, the only time we saw kids with diabetes is when they presented with type 1 diabetes. Now more than 50% of children that we deal with present with type 2 diabetes. This is a slide of a young girl who lost about 25 pounds once her parents bought her a bicycle. There are lots of reasons for why adiposity has increased and our health has deteriorated. We basically have engineered activity out of society. We have what the nutritionists refer to as portion distortion. And we tend to even engineer activity out of our own activity. This is an actual health club in San Diego. So again, I'm not touching this, so somewhere that's on the timer. So we tend to not exercise to go to exercise. So today we're going to focus on physical activity because physical activity really lends itself to a lot of positive outcomes, both from a physical, emotional, psychological, and learning perspective. And these are data from the CDC. Don't worry about the bottom part of it. That's us, older adults that are no longer in school. And you can see we don't get much exercise. Some of us are going to try and get a little exercise during the lunch break, so we'll try and finish on time. But if you look at children and adolescents, you can see that young children do reasonably well, but less than 50% of children receive the recommended amount of daily physical activity. And then as children become adolescents, the amount of physical activity decreases dramatically. And it's a real concern because it's one of the areas in school systems that tends to be cut. We were talking last night at the reception about a piece that came out in the New York Times last week about physical education in the New York City school system, which is mandated. I mean, it's part of the law, and what percentage of the New York City schools are not complying. And we'll talk a little bit about that later. So in terms of the format of the panel today, we have 4 speakers. The first speaker is Russ Pate, and he's going to talk a little bit about sedentary behavior and physical activity and talk a little bit about how that influences health. Then Stewart Trost is going to talk about policy and environmental influences and how to engage preschool children into physical activity programs. Karin Pfeiffer will then present some data on ingredients for successful engagement in physical activity programs and school-based programs. And then finally, Robert Garcia will talk about equal justice, democracy, and livability for all, and talk a little bit about advocacy at the community level. So it's a great pleasure for me to introduce Russ Pate, who's our first speaker. I've known Russ for a number of years. I always thank him every time we get together because Russ was at the University of Virginia as a faculty member before I got here, and UVA's loss was my gain. Because when he left to go back to South Carolina, I ultimately obtained the position here. Some people would say that it was UVA's loss and South Carolina's gain. In any case, Russ has held a number of very important roles, and I could spend his entire 15 minutes just talking about those. He's a past president of the American College of Sports Medicine. He's been involved in most of the writing groups responsible for physical activity patterns, including writing groups for the CDC, for the Surgeon General's report. He's published over 230 papers in the area, and he's currently the lead on the writing group that's revising the physical activity guidelines for the United States. So Russ, it's a pleasure to have you here.
Thanks, Art. It really is wonderful to be here, and I'm very pleased that this topic has been included in this program. I think you all know that this issue probably is not a typical one for a conference of this sort. You won't be surprised to hear me say that I think that physical activity is central to child development, but I understand it's not always seen quite that way in the context of a conference like this, and so I'm delighted to be a part of this outstanding program. I'm also very pleased to be working with Art and Stewart and Karin and Robert. This is not a random sample of people who study these issues. I can tell you that these folks are doing great work, and in many ways I see my role this morning as really just laying the groundwork for the presentations that they're going to make in a few minutes. Art alluded to the fact that I do have some connections to UVA, and it really is wonderful to be here. Aside from University of South Carolina, where I've worked for a long, long time, UVA is probably the other university that I have the most connections to, and I could use a lot of my time this morning to tell you about all of them. I'm not going to do that, but Art mentioned that I was here for a great year a long time ago, and I'm also thrilled that John Serrard, who did his PhD with our group at University of South Carolina, is now a faculty member here at the Curry School. Kids today live in a world that is enormously different from the one that their bodies evolved to support. It is just unbelievably, and it's unbelievably different from the world that I grew up in. You know, it wasn't fun to be inside when I was a kid because there was nothing to do there. Absolutely nothing to do. There were cartoons on Saturday morning after I got to be about 5 and we got a TV. But you know, that was over by noon, and you know, by 12:30 you were bored stiff. You know, so you had to go out and find something to do. Probably another kid to raise hell with, or you know, throw the ball off the roof. But kids today don't have to do that, and they are paying, I think, an enormous price, and our society, I believe, is paying an enormous price for the enormous amount of time that kids spend inside, being inactive, not being outside, being physically active. So I've opted for a title for my presentation that you see here that, in all honesty, I can't really speak to yet, but if you guys do this again in about 5 years and are nice enough to invite me back, I think we're going to know a lot about this issue. You know, our field really cut its teeth by studying vigorous exercise. And we've gradually, I think, over the last 30 years or so, moved down the physical activity intensity continuum. We got interested in moderate intensity physical activity 15 or 20 years ago, and now we're getting very interested in sedentary behavior and light physical activity. And before long, I think we will have covered the whole waterfront, and hopefully we'll have learned a good bit about the interactions between time spent in vigorous, moderate, light, and sedentary levels of activity. So I'm going to do what I can do to sort of introduce you to some of these issues and then get out of the way and let my colleagues tell you about what we should be doing about this. I was honored to serve on the on the Physical Activity Guidelines Advisory Committee, which did the background work that informed the first federally supported physical activity guidelines, which were released in 2008. And my job on that committee was to chair the subcommittee on physical activity in children and adolescents. And these were the conclusions that we drew from a very extensive literature review. And it was that the well-documented health benefits of physical activity include improved higher levels of cardiorespiratory endurance and muscular fitness, a more favorable body composition, lower risk of overweight, and so on, improved bone health, improved cardiovascular and metabolic health biomarkers. And in addition, I think particularly relevant to this meeting, there was moderate evidence at that point, and I'll go out on a limb here and say I don't think it's going to be moderate evidence for a whole lot longer, of reduced symptoms of anxiety and depression, mental health outcomes. And I will tell you that I think when the guidelines get done again at some point, we'll know a lot more about the relationship between physical activity and academic achievement. It is an academic feeding frenzy around this issue right now. It is so much on the front burner and a lot of work being done, and I think we're going to learn a lot about this over the next few years, but it didn't make either of those lists in this last review. The resulting guideline was that, released in 08, was that children and adolescents 6 to 17, and my group has worked a lot with preschoolers, as have others here on the panel, and I think the next time the guidelines get done, there will be guidelines for preschool age kids as well, but this guideline was not. And it recommended that kids be physically active for an hour a day, and that most of that hour be spent in moderate to vigorous physical activity, but that it should also include on a regular basis vigorous intensity physical activity on at least 3 days, and that it should also include muscular strengthening activities as well as bone strengthening activities. Kids, as you know, develop their skeletons as children, and then it's kind of a slow, steady decline in bone mass after after adolescence and early adulthood. And so if you're gonna get bone, you got to get it as a kid. And laying around watching a screen is not a good way to build bone. And so we've got to, I think, highlight this one. It's really a time-critical one. So how are kids doing against that 60-minute guideline? Well, Art scooped me, not that well. Depends a little on how you try to answer the question, but these are data from the Youth Risk Behavior Survey, from the most recently published survey. This is self-report of kids, and you can see that around 25% of boys and down around 10-15% of girls say they meet that 60-minute guideline. Now I'm going to tell you they don't know. Okay, they don't know. Self-report responses to a question like that one in the YRBS are kind of a general impression that kids have about their own behavior, but the responses to those questions are really not terribly valid. We're now using motion sensors, accelerometers widely, including in some surveys, and these are data from one of the later rounds of the Haynes survey, where accelerometers were put on kids, and you can see that aside from the youngest group measured in this study, which were the 6 to 11-year-olds, and I've looked at it, if you split that 6 to 11, it really is only the youngest half of that age range where a lot of kids are actually meeting the 60-minute per day physical activity guideline. The vast majority of them are not. Only about 10% of kids in the older age groups are getting an hour of physical activity per day. So as I've mentioned, our interest in activity and inactivity is in transition right now, and clearly there is growing interest in sedentary behavior, and I think there's been a tendency to sort of write that one off as, well, that's really just the flip side of physical activity, isn't it? Well, no, not exactly, not exactly. So if you define physical activity as moderate to vigorous physical activity, something like brisk walking or more intense than that, and if you define sedentary behavior really as inactivity, not moving much at all. There's a big zone in between there, which is light activity, which is sort of slow walking and kind of shuffling around, or seated with upper arm motion and so on. And so kids can be physically active and also highly sedentary, or they can be low sedentary and highly active. And you can piece those two together any way you want to. Think of them as independent variables, okay? That's kind of the way we're coming to think of it. Well, how much sedentary behavior do kids get? Well, our group was involved in a large multi-center study of middle school age girls called TAG a few years ago, and these were the communities included where the girls were sampled, and we measured a lot of stuff, including putting accelerometers on these kids. And the bottom line is this one, and you can see that the big blue sector in the pie is time spent sedentary. That's really essentially no movement, and light activity, which is kind of shuffling around, slow walking, or something probably less intense than that, is the big green sector. And so up to the present, we've been spending most of our time kind of focused on those two little sectors up at the top there, which you can see between the two of them add up to about 22 minutes per day. So this is across a quite diverse sample of middle school girls, about 20 minutes, not close to the 60-minute physical activity guideline. It is also possible to look at the NHANES data because the kids wore accelerometers, and this is a paper from Chuck Matthews looking at hours per day spent sedentary, and you can see it's up in the range of 7 or so hours, which is not inconsistent with the TAG data. These are data from the UK. There's a large birth cohort study called ALSPAC, still ongoing. These kids are now in their 20s, and we've had the opportunity to work with the folks there on the physical activity and sedentary behavior data that they have. And the ALSPAC data in the UK are actually quite consistent with the data in the US in terms of time spent with kids inactive. Kids live in a media circus today. I mean, they are just absolutely surrounded by screens of one sort or another. And you know, the penetration of this into their lives is, you know, beyond imagination. I mean, there are computers and mobile phones and TVs everywhere. These kids exist. And, you know, we're now, you know, there's schools in our area, probably in this area, where, you know, where they've all got iPads in school, and, you know, textbooks are going away and all that. You know, in all honesty, sounds cool. I worry, you know, it's just kind of, from my perspective, one more screen, you know, that kids are going to be glued to all day. And, you know, school's not a terribly active place already, and I'm worried that, you know, this is going to have the effect of making it even less active for those 6 to 8 hours that kids spend in the school. You may have seen a news release in the last week. The American Academy of Pediatrics just changed its guideline. This is the old one. They moderated this a little bit. They said kids under 2, the old guideline said kids under 2 shouldn't watch TV at all. And a lot of people went, what world are you living in, pal? You know, I mean, come on, you know. And so they moderated that a little bit and changed the guideline, but, you know, still basically saying young kids should not be exposed to TV very much. And older kids, you know, there need to be limitations on it, 2 hours or per day or less is the AAP guideline. And we're not doing terribly well in terms of kids meeting that AAP guideline. And the TV viewing habits of children are summarized here. Most kids just watch a lot of TV, and way more than, you know, anything that would be seen by most of us as necessary. And, you know, is it possible for a kid to be physically active when he or she's watching TV? Yeah, it's possible. You know, it can happen, but it's not typical. And you know, we've got to figure out how to deal with this. This is not in kids' best interest for this to continue longer. I'm going to finish by showing you a recent study, and I'm going to cut to the bottom line quickly because my time is short. But if you can see this, these are body mass index distributions for 9-year-old kids and 15-year-old kids, drawn from a large study that was coordinated by Phil Nader at the University of California, San Diego. And what it shows is a contrast between kids with a lot of exposure to sedentary behavior versus those with low exposure. And the curve where you see the tail going out to the right is the high sedentary kids, and at age 9 on the left and age 15 on the right. So you see that tail at age 15 kind of slides out there further. And this is a representation applying a statistic called quantile regression, which we've gotten sort of interested in using, but it allows you to look at relationships between exposure variables and dependent variables like body mass index, rather than just looking at the mean and how those associations play out. You can really look across the distribution for a variable, and that's what we see. So what's going on here? I think it is that some kids, by virtue of their family genetic background, are much more likely to be able to store a lot of energy and become overweight. So it's those that are probably at the high-risk end of the continuum that are most at risk of gaining excessive weight with overexposure to sedentary behavior. Now, the interesting thing is these patterns are adjusted for moderate to vigorous physical activity. And so I'm showing this because I think it's the kind of work that we need a lot more of, looking at the interactions between moderate to vigorous physical activity, probably light physical activity as well, and sedentary behavior to see how these interact. Right now, there have been some studies that have done this. The patterns are not yet consistent. We need a lot more replication in this work. Finally, I'll draw your attention to one last thing, and that is Marc Tremblay in Canada just published just earlier this year a nice review of the relationships between sedentary behavior and a wide range of outcomes. And I won't take the time this morning to talk about that, but you'll find it, Tremblay, T-R-E-M-B-L-A-Y, or it's in the slides if you have them. Excessive exposure to sedentary behavior is not a good thing in young kids, and we've got to address this. Finally, again, let me thank you very much for having me here, for including this topic in this session. And in the end, we deal with kids as integrated beings. As scientists, we like to be reductionist and kind of study our little variable. But in the end, they're just kids. And I think that physical activity is central to their lives and their being and their health, for sure. And I think we're learning the hard way that when kids don't get very much activity, spend excessive amounts of time being inactive, there's a huge cost associated with that. Thank you very much.
Thank you, Russ. So I think what we're going to learn over the next 2 days is that it's going to be difficult for people that typically give keynote addresses at conferences to limit their conversation to 15 minutes. But we've tried to do that purposefully so we would have enough time to have a lengthy panel discussion. So our next speaker is Stewart Trost. Stewart is at Oregon State University and the Exercise and Nutrition Science program. He's published over 95 papers in the area that he's going to talk about today and has written 10 book chapters. He was instrumental. This epidemic of physical inactivity is a pan-epidemic, and Stewart's originally from Australia, and he's written guidelines for the Australian government and was a member of the panel that developed CDC guidelines for physical activity patterns in youth. And Stewart's going to talk to us today about engaging preschool children in physical activity.
Well, thank you, and it is indeed a pleasure to be here. I grew up in a suburb of Brisbane, Australia called Virginia, so I guess I'm back, can claim that one. So I'm going to talk a little bit about preschoolers today and sort of outline a number of sort of exemplar studies that give us insight into what policy and environmental influences we should target. We certainly don't have time to give an extensive overview of literature on the intervention in this area. Much to Art's chagrin, I added a slide at the last minute, if I can find it, and just based on the last presentation, and this sort of nexus idea. And we're really interested in how physical activity affects things other than obesity. And one of the things that we're looking at in studies of preschool is how active play, measured objectively with accelerometry, affects self-regulation and academic performance or achievement. And this is just threw it in there that we have found that self-regulation is a mediating role there between physical activity and math, vocab, and reading performance. So, and this is in 4-year-olds. And so we really think that there's wonderful potential for collaborations, and there's a lot more to physical activity than just the obesity prevention angle. And when we think about it, if we're really setting up kids to be successful and have youth assets and many things, it's a real shame if they have diabetes when they're 50. So those are the things that we'd like to work on, and not just directly influence activity, but their long-term health. So I'm going to talk a little bit about studies that really look at policies and practices at the centre or the childcare centre, and then we'll follow up with studies that really focus on how outdoor environments affect physical activity behaviour in preschool, and then just a few experimental studies on that actually have manipulated or tested experimentally some aspect of the preschool childcare environment, and then wrap up with some conclusions. So the first one is actually from Dr. Pate's group. Marcia Dowder at University of South Carolina did a study with 20 child care centres in South Carolina, nice diverse group, 300 or so kids, and these were from Head Starts, from religious institution, preschools, as well as for profit. And this idea of, they did a number of assessments to evaluate the environment. And so one of the things that you'll see me mention in this talk is the observational system for recording activity in preschools, the OSRAC-P, which was developed by Dr. Pate's group at South Carolina. And that's basically an objective observational tool that measures both activity and the context in which it occurs. They interviewed directors, they measured things in the classroom, playground audits, and you're probably familiar with ECHAS, the Early Childhood Environmental Rating Scale, widely used measure of childcare quality. And I don't know if you can see that, hopefully you can. So the number of things emerged here as things that made a difference in the level of physical activity. So these centres were classified as sort of widely promoting physical activity, or PPA, or non-promoting physical activity. And if you can see here, the overall quality as measured by ECHAS, less exposure to electronic media, as you would hypothesize, the presence of portable play equipment. These are things that you can just roll out, like a ball or a hula hoop. They're not attached to the ground. And in fact, you see fixed play being a significant predictor of physical activity, but it's actually the lowest score on fixed equipment provides more activity. So having a plastic castle bolted to the floor is not exactly going to promote a lot of physical activity. The playground size, the smaller the size, the less activity. And if you had any one of these significant predictors, you had much more physical activity going on. So this gives us an idea of what environmental policy types of attributes promote physical activity. Now, some of our own work, we've been looking at another another sector of the childcare is family childcare homes, which takes care of over 1 million kids every day. It's about 5% of the total non-relative care in the United States. And you can see that these are businesses run out of your home that take in about 5 to 6 3 to 5-year-olds. And we see the same types of findings, that if they're exposed to outdoors, get outside and play, we do see a positive finding here for fixed equipment, which makes more sense when it's a home and not a playground centre, perhaps. The portable play, adequate indoor space, if the provider goes out and is active with them and prompts them to be active. And funny enough, if you provide training to childcare caregivers, they actually, in physical activity, they will actually give you more physical activity. And that's an encouraging finding. So another study that I want to sort of highlight is Julie Bowers out of Diane Ward's group at the University of North Carolina, a fairly large sample of childcare centres. And they have another observation tool. It's called Environment and Policy Assessment and Observation. So it's a document review, direct observation, and self-report through director interviews. And they also use the OSRAP, or the OSRAC P instrument. Oops, I went backwards. So they looked at a bunch of different activity influencing factors here, and you can see that some active opportunities is probably the strongest correlate there. If you actually provide opportunities for outdoor, provide structured activity, if you make a plan to be physically active, then you will become, you will see higher levels of physical activity. You see sedentary environment there being a negative correlation. It's a counterintuitive finding because the actual measure is reverse scored, so that higher scores means that there's less sedentary. And in that particular study, that meant actually, the less sedentary activity opportunities, the less active they were. And perhaps that was because they just measured how many TVs and how many VCRs and how many computers they had, which may have been a marker of how well off or how much resources a childcare centre had, which also is somewhat predictive of physical activity. And it's all this reverse causality problems, of course, we get when we do cross-sectional work as well. Based upon their instrument, they classified, did a median split and had the high versus the low quality centres, and that we see significant difference in the percent of observations and the kids were engaged in MVPA, and they had lower percentage of intervals engaged in sedentary activity. So it's another indicator of some environmental and policy attributes that we can link with more favourable levels of MVPA and lower levels of sedentary behaviour. Just going to skip that here. So what about the built environment of a childcare centre? In the physical activity world, at least, we're very interested in how the physical attributes of environments and behaviour settings influence behaviour. And childcare centres are not an exception there. This is a study done in Stockholm by Balderman in 11 preschool centres, and they came up with a measurement system that provided an index of how, so the blend of natural features and how that promoted physical activity. So just the size, the total outdoor, the mix of shrubbery and broken ground, and this integration of play areas with vegetation, so whether there were shaded trees by paths, etc. So we're really looking at sort of the landscaping, so to speak, of these centres. They were basically dichotomized into two groups, high versus low on these three different aspects, and we saw measured pedometers. They did the steps counts over across days, and across the entire sample, the high scorers had more physical activity. They also saw a significant difference in the boys, a trend in the girls, but that wasn't significant. They found that the more indoor space you had for activity, the more activity you got. And so that sort of talks about some built environmental features. Another study, a European study in Belgium by Cardon, really looked at more aspects of the playground. So this idea of how do we set up these playgrounds to promote more physical activity. They did a fairly extensive coding of these different childcare centres and measured physical activity with a pedometer. And as you can see, I think what I find in this slide is to point out that what is not significant, a lot not significant there. So this idea, if we provide a lot more toys to play with, a lot more basketball hoops, a lot more mouse traps to play with, we're going to promote physical activity. One of the things that you find that was significant was recess duration, but it was inverse. The longer the recess, the less active they were. The ground surface was significant in boys. When you think about boys, if you don't have something to ride a bike on or to bounce a ball on, it's not as conducive to physical activity. And perhaps another significant finding there is the child per square metre. So if you had a very crowded physical activity area or playground, highly dense, that was inversely related to physical activity. skip that here. Now, so we've seen this pie graph just earlier, but now we see it in preschoolers. So when we look at the activity levels of preschoolers across an entire day, we see in this particular case that they're even more sedentary than we saw in the school-aged children. In fact, that across the entire day, less than about 3% of the time spent in moderate to vigorous physical activity. In this particular study, they actually doubled the amount of time allocated to recess from 30 minutes to an hour. And you can see that's the recess, the one on your left there, and it didn't make any difference. So this certainly suggests that simplistic sort of solutions, like just give them more time outside without really using any sort of constructive use of that or programming, may not be the answer there. And finally, I think we'll just talk a little bit about some work we did in terms of integrating physical activity into the existing childcare curriculum. So we hear a lot about moving and learning and the kinesthetic value of learning and how it facilitates learning in young children. And there was very little evidence of its effectiveness in terms of promoting physical activity. And so we did a study to look at that, where we integrated activity into all the different areas. And our minimum was to have at least 2 move and learn activities integrated into a 2.5-hour childcare session. And we did direct observation and accelerometry, and these sort of reflect that we were successful in actually integrating physical activity into the school day. If you look at here the circle time, and if you're familiar with the childcare setting, circle time is when you actually put carpet around it and actually tell them that you're not allowed to move your butt from that square. And so we're actually telling them, please do not move, which is somewhat of a torture to many children, particularly my kids. And we can see that we're successful in terms of the odds of having an MVPA observation occur during these times was significantly more likely during circle time in the intervention group. We also saw it in unstructured time as well as indoor unstructured time. And, we certainly didn't see it in snack time, so it was sort of a control there. And we just saw, as we see, we saw modest increases in the amount of moderate to vigorous physical activity. Again, the numbers themselves are a little disheartening in terms of the amount. This is over a 2.5-hour childcare session where we're talking about 10 minutes or so of moderate to vigorous physical activity being significant and, being a success story of the intervention. So it's a little sobering. So to summarize here, we know that there are a number of factors that we can focus on through policy or intervention that could promote physical activity, and in terms of really explaining the lot of variability we see between childcare centres. We know that attributes of the play areas themselves, the size in terms of the density, the focus on portable play equipment rather than fixed. We see that outdoor time's important, but just simply increasing those time is not going to work, and that we need maybe multiple breaks. And that and it comes back to that point about really in-service training and pre-service training in terms of staff training behaviours influence the level of physical activity. So providers who get some training, even if it's just one day of physical activity training or some reinforcement of their role in supervising and prompting kids during the recess, that relates to more physical activity. So I will stop there and look forward to having more conversations in the next day or two. Thank you.
Thank you, Stewart. Our next speaker is Karin Pfeiffer. Karin is on faculty at Michigan State University. So while the Packers may still be undefeated, the Badgers have fallen from the ranks of the unbeaten. I'm sorry about that. Karin has spent the last 15 years working in the area of physical activity in children, and has spent much of her time working in school settings to try and promote physical activity in elementary and secondary schools. She's published over 65 papers in the area. And today we've given her the daunting task of talking about physical activity in the school setting.
Okay, well, thank you, Art, and the rest of the Youth-Nex team for having me here. I'll just echo Russ and Stewart's comments that it's an honor and a pleasure to be here. And yes, Art, it is a daunting task to discuss hundreds of studies with you in 15 minutes, but I'm giving it a shot here. Luckily, Russ set the stage and Art as well for my first point, so I won't spend too much time telling you why we need to conduct school-based physical activity interventions. But I will tell you a little bit about what the data have shown so far and what we've done, and what I was calling ingredients in our recipe for success in school-based interventions for physical activity. There are a few other considerations which you will see for most of you in the room who already are in school types of environments. Some of this might be the duh information for you, because I bet our issues look like your issues. And that goes for some of the practical considerations as well. And then hopefully I'll have time to just give you one example of some work that my team's been doing at Michigan State in Project FIT is one of our studies. So again, I'm just going to breeze over this. Russ actually showed you, and Art both showed you these data already. We know that our children and adolescents are not physically active enough. One thing they didn't discuss too much is that this is a bigger problem for adolescents. So we see a sharp decline from childhood to adolescence in activity, even more so in girls than boys, but in both age groups. And so our adolescents are actually less active as a group. And it pretty much is obvious from some of the statistics out there that if we can intervene at any time point, it might be doing some good for us. So that might be pre, during, or after that precipitous decline in activity. That might be useful for us. And also, as was mentioned this morning once already, children in schools happen to be a very captive audience. So we know that is one place where we can reach them, and that is what most of us try to do. So I thought what I would try to do is talk to you about what we know so far and really address this from the perspective of some review studies that are out there, because that does give a nice overview of what's been going on up to this point in time. And there have actually been several reviews of these types of studies in addition to several studies conducted. And when we started doing these types of reviews in the 90s, and particularly in the late 90s, we didn't look very successful. And we were not too good at being able to do much about increasing physical activity. And I think for a while, others in and around our field were a little bit down on us. But as you'll see, we've made some progress, which is definitely a good thing for us. And most of the recent reviews, there are about 4 of them that I'm covering here, and I'll show you the citations at the bottom. Now we're starting to show positive results for increasing physical activity. But what's interesting is most of the time that's just during the school day. So we still haven't been able to do the best job necessarily addressing out-of-school physical activity up to this point. The successful trials have usually been a little bit longer in duration and use a multi-component approach. And so what I mean by a multi-component approach in our field is we are addressing things maybe in the environment and the individual level. We're having multiple components, physical education class, health education class, maybe things in the community outside of school. So the studies that have used more components have done a little bit better in the past. Now, we've seen better results typically in children than we've seen for adolescents in a lot of our school-based physical activity intervention studies. And I think that we're starting to see a little bit more in adolescents, but we've got some work to do in this age group, and I guess that's probably not surprising given those of us who are familiar with adolescents. And we might have different answers just simply by the physical activity assessment that we choose. And so Russ was showing you data earlier from both survey and objective measures of physical activity, and we've seen a little bit of different results just simply by using these different techniques to assess activity, and that's in the past possibly been a bit of a problem for us. And then I have listed here those 4 fairly recent reviews that I discussed, but then, hot off the press, a group out of Europe, led by Susie Kreemler, they have come up with now a review of those reviews, And then they've reviewed studies performed just since January 2007 through December 2010. So this is now the latest and greatest review of all the reviews. And what you'll see is actually very similar to the findings that I just presented from those recent reviews. And they do refer back to those reviews, of course. Now, interestingly, 20 trials were relevant during that time frame. So quite a few more studies popping up on the horizon over the last few years. And 16 of those reported effects with the physical activity outcome. This review also examined physical fitness as well. So that's why some of them were just fitness-only outcomes, but 16 of them were including physical activity. And for those of us up here at the table, I think physical fitness and physical activity are two very different constructs, but to some of you out there, they might seem pretty similar or the same. And fitness actually has to do a little bit more with the physiology, whereas activity is more moving your body, just to give you a basic definition of what the difference might be between those. But what we're seeing now is more and more people were taking our own advice. So we're seeing more multi-component studies, and we're seeing people adding a family or community component in those most recent reviews. So what was really nice for us to see is that in this recent review, every study that had a physical activity outcome reported a significant effect. So they were able to increase physical activity. And particularly given what was the state of the landscape in the 90s, this makes us really happy. This is nice for us to see. And we're seeing now that we're having effects outside of school as well as in school. So that is also very nice for us to see. We're seeing results, by the way, for both subjective and objective measures of activity now. So we're seeing a similar pattern regardless of how we're assessing the activity, which is pretty nice too. And then in the Creamler study, they highlighted a couple of randomized controlled trials. And it's just nice if you're interested in this area to give those studies a look and see the kinds of things that they were doing. They were deemed to have pretty high public health significance, nice measures using accelerometry. And so those kind of studies that are having an effect are lasting a bit longer as well, as we saw from previous reviews. So as I mentioned, what are we really seeing? We're seeing that we have more studies now than we have in the past, so we've really had an increase. This was, as I mentioned, 20 trials over about a 4-year time period. And the Dobbins review that I had cited on the earlier slide, that was a Cochrane review. So that was a long time and a lot of literature through which they perused. And so you're seeing even more studies coming out recently. And again, as I mentioned, the ones that were examining physical activity outcomes saw increases in overall physical activity, not just during the school day. And we had similar results for the different types of assessments. So good message here. The other message from the Creamler study is that the studies they deemed as being the best in terms of rigor, they did include children. So again, they haven't seen great results for adolescents out there yet either for what we've done up to all this point in time. The multi-component approach over that longer duration seemed to be a bit better. And the approaches that seemed to work in the studies that they reviewed really dealt with school curriculum, particularly in physical education. So if you can have a physical education expert involved, you're likely to have a little bit better success. And I think that we've seen that in some of our work as well. And then the family involvement was a pretty key piece in a lot of the studies. And I think that that is an area that we have a lot of work to do, is determining how we can involve families when we're at the school level and we're trying to reach out to the community and to families. We have some more work to do, at least in our field, in how we do that. So for physical activity interventions in the schools, what should we do in order to be successful? Well, I think it's pretty obvious by now that I've mentioned the multi-component approach several times. And I think an adequate time frame is really necessary to implement and get things settled into what we're doing in the school environment. The family might not be as relevant for adolescents, but it certainly seems to be for children, so we should continue to approach that. For adolescents, some of you might know this better than I do, we probably want to start looking into peer relationships instead. Maybe that would be a little bit more salient for us. But the environment is somewhere we need to go as well. We need to really pull in environmental components into our future research, and Stewart was mentioning that in the preschool, and we need to do it in our in-school interventions as well. Sustainability, I think, is one of those things that's always very difficult, but we can't keep our eye off of it. We really need to figure out ways to implement something that when we step away, it continues along. And we have more work to do in that area, but we definitely need that. And you cannot forget doing some formative evaluation before you head in and conduct your intervention, and then on the during and after our process evaluation, determining what kind of components, how well we implemented. All of those things have been very important in some of the results that we've found in school-based studies, because how well your intervention is implemented may have something to do with whether or not you're able to find results. So we highly recommend doing that. Mediation effects are something that we're looking more and more into. People are getting more interested, and we need to look a little bit more at this. And I echo the comment earlier about finding some economists. We really haven't done a lot with the cost effectiveness concern in school-based physical activity interventions, so we need to be looking at that. And then, as Russ mentioned, we're on a track to head more into the sedentary behavior realm, and so we want to be considering those sorts of things. And what's nice about a school environment is you can combine less sedentary behavior with some academics as well, so that you're not missing out on some of that time that they might be learning other skills. Now, other considerations that we have in the school-based area is that we really aren't as well informed about cultural tailoring, not only to racial ethnic minorities, but then to the lower income populations as well. So we've got some work to do in this area, but we really have to take it into consideration. And then we need to infuse some novelty, and that's where I hope that interacting with this group helps us out quite a bit. Media has already been mentioned today, and technology. We can use these types of things to our advantage, and we've even seen some intervention work. A colleague of ours at South Carolina was a nutrition expert, and she infused students creating public service announcements about eating healthier that were sent home to parents, and making slogans and campaigns and things. So we can use that sort of thing in our favor, I think. And maybe even the active video games. I don't know where that's going to go, but there's been some interest in that lately. And really, technology needs to be infused as well, and that's for both how we measure, but also for intervention tools. I think that texting right now is one of those things that we need to take into consideration with our school-based interventions. Even though you probably shouldn't be using your cell phone at school, we should consider how we can use this, particularly for those out-of-school kinds of times. And then there are even some people doing work with what we call activity-permissive environments. So not simply just sitting at your desk, but either standing or sitting on an exercise ball while you're in class at school. And it's not taking away from any academic time to do that. And so people are getting into those kinds of areas, which I think has some promise as well. Naturally, you have to take into account your age group. You have all kinds of different considerations depending on elementary, middle school, high school, how you're going to implement. And so we always have to think about that. And I think intergenerational efforts would be of use to us, particularly in the younger children, if we can incorporate grandparents and grandchildren getting active together, those sorts of things. And then naturally, I think some of what might come out of this meeting is maybe we can infuse some of the activities for positive youth development with physical activity, and I think those are areas that we need to really think about. Practically speaking, I can't say enough about knowing your environment, which I think this is the duh slide for those of you who've been in the school-based realm. You know you need to know your environment. You know that we're asking people to change a behavior, which I think is always one of the most difficult things to do. You always have to find that champion, someone in the school who really is into your cause and then will help you achieve what you want to achieve. And I'm certain that's true for some of these other areas of youth development as well. And who are the stakeholders in addition? So not only just one champion, but who are the stakeholders? And we have learned that we have to really communicate with these individuals. and continue reinforcing our goals, because it's not just enough to mention it. We have to continually stay in there and let them know what we're trying to achieve and work really with them, being collaborative rather than being prescriptive of this is what we want you to do, but how can we do this together? And I think that we've learned that in our work. And then just briefly, I can tell you more later about this too. I had an example of a study that we've been working on, Project FIT. It's in Grand Rapids, Michigan, in some inner city schools. We have 4 intervention schools and a control school. Over 95% of the children attending these schools are eligible to receive free and reduced lunch. So we are in a low-income area. We have about 50% Hispanic population, 30% African American. So we've got some good racial ethnic mix in our sample. These are elementary schools, so we are addressing the whole school, but we're taking measures in 3rd, 4th, and 5th graders. And the intervention has lasted 2 years. So we just finished this spring, and we're in the middle of crunching our data right now. But the nice piece is this study really shows how you can take components together and really make a multi-component approach. We had a school component, we had a community component that we were working on at the same time, and we actually had a social marketing piece as well to this study. So we came at it from all these angles. And it was a lot of hard work and a lot of people at the table to try and make that happen. But I think in the end, we're going to see that it was hopefully successful. The Eisenman et al. Publication, that's our baseline results and the design of the intervention. So if you're interested in learning a little bit more details about what that was, you can take a look. In the schools, just briefly, we worked on some training. We tried to infuse physical activity into the school day as well as nutrition education. And we had some healthy eating coaches, faculty and staff, trying to get kids to eat more fruits and vegetables at lunchtime and things like that. And I can tell you more later during the conference and things too if you're interested. We were supposed to have a staff wellness component, but you know, life is reality, and when Blue Cross Blue Shield of Michigan funds you, and then there's a different agency taking care of teachers' insurance, sometimes people clash and things don't go as planned. Just to tell you a little bit about our population, we had 48% overweight and obese, so I think you saw some of the statistics earlier. This is definitely more than the national average, and we only had 30% meeting physical activity recommendations. So at baseline, we weren't looking too good, and especially for screen time, which is one indicator of sedentary behavior, we only had 24% meeting guidelines for screen time. And so you can see we had a lot of work to do. We're still figuring out what our outcomes are. We're analyzing our data right now. We've seen some positive results. This is very, very preliminary for screen time, which is nice to see that we're reducing some of that screen time. We have process evaluation data that help us to know how many minutes of physical activity were really implemented in classrooms and nutrition education and that sort of thing. We interestingly did a little better in grades K through 2 than we did in 3rd, 4th, and 5th graders. So that kind of goes to show you that maybe some of those teachers are a little bit more interested in doing more things in their classroom. I'm not real sure. We have to look at year 2 as well. But to sum up, I think that school-based intervention has made a lot of progress in recent years, and we certainly have a ways to go in terms of what needs to be done, but I think that collaborating with others in groups such as this will really help us out. And also, you know, if we consider the ingredients in the recipe that I considered, you get the right chef to put it all together and mix it up for you and present it well. I think that we do have an opportunity to really be successful, even more so than we have. And so I'm looking forward to possible idea exchanges and things that can come out of this. And that's my physically active 7-year-old. Thank you.
Thank you, Karin. So our last speaker of the morning is the one non-exercise scientist on the panel. So don't shoot the messenger, but we invited a lawyer. Robert Garcia is trained at Stanford both as an undergraduate and in law school. He's currently the executive director, counsel, and founder of the City Project, which is a nonprofit legal and policy advocacy organization based in Los Angeles. He's been involved in influencing over $20 billion of support for underserved populations in a community setting. He's won a number of prestigious awards. I guess the one that he might be most proudest of, or the one that stood out to me, was when your alma mater calls you a civil rights giant, and your alma mater is Stanford. That's a fairly substantial recognition. So Robert's going to talk to us today about community engagement and how to engage underserved populations in physical activity programs.
Thank you. How do I advance this? Push the green? Thank you very much. As you mentioned, I am not a doctor. I am not an academic. I am not a health professional. I am an attorney. I'm a recovering litigator. And I'm very happy to be here, although when Professor Lerner was speaking earlier today in the keynote, talking about measurable standards and coalescing on a second-order latent variable, I was sure I was in the wrong place because I have no idea what that means or what most of he talked about means. But then he got to his last slide, and the last sentence on that slide, which explicitly said that the goal is to achieve to achieve social justice, democracy, and livability. And I do not make this up. The mission of the City Project is equal justice, democracy, and livability for all. And so I felt like the bourgeois gentleman in Molière's play, who, upon being told what prose is surprised and delighted to learn that he's been speaking prose all his life. And in fact, much of what we do at the City Project, and we are a nonprofit civil rights law firm, much of what we do is to translate evidence-based social science research into policy, law, and systemic social change. So we are very dependent on folks like you and on measurable standards that coalesce on a second-order latent variable. We just need to work with experts to translate evidence-based research into terms that elected officials, judges, but also the community can understand. And I will focus on the strategies we use, but also the areas that we have worked on. And the City Project is over 10 years old now, and we have focused on 3 major areas. One is quality education, including physical education. 2 is equal access to parks and recreation. And 3 is the related human health implications of the lack of places for physical activity and healthy eating in underserved communities. And like you all, we don't see human health simply as a obesity issue, although that's very important, and health foundations have been very important for the work we do. We see public health as going far beyond reducing obesity. And when we start a matter, we do not start, frankly, with social science research or even legal research. And we don't measure results by publications or even by laws passed. We start with the reality of a child's life, like in this photograph, which happens to be in the Coachella Valley, which is in the far eastern part of California, almost in New York. But we start with a reality like this. And this photograph, this is evidence. You know, as I say, we depend on social science evidence-based research, but from our perspective, the primary evidence we start with is the reality of children's lives. And we depend on that because 10 years ago, when we started the City Project, 15 years ago, when we started focusing in these areas, there was not this tsunami of research on the importance of physical activity, the importance of access to parks, whether or not schools enforce physical education. There was virtually nothing in the area. But we knew, based on what we call walking around the neighborhood methodology, that the reality of children's lives was what is depicted here. And it's not just us. This actually is a photograph by a 13-year-old girl. It was a project by Venice Arts called Picturing Health. And the children were given cameras and just told, come back. We want you to take images picturing health. And so this 13-year-old girl knows that picturing health encompasses a place to play. And she also knows that in the community that she knows about, there are no places to play. And so you see this little Latino boy with a soccer ball apparently in somebody's parking lot. And people ask me, well, what do Latinos look like? How do you know he's Latino? Well, first of all, he has a soccer ball. And second, he has no place to play. So that is the kind of evidence we start with. And we don't even view it as a legal issue. We view it as a problem. And we try to come up with solutions to that problem. And we will depend on legal tools. We will depend on social science tools. We'll depend on the strategies that I'll illustrate in a moment. This is our flagship project. This was the first project the city project started on. This is what is now the Los Angeles State Historic Park at the Cornfield. It had been an abandoned rail yard for 10 years when we started the project. Today, it could have been warehouses. Instead, it's a park. The New York Times called this victory a heroic monument and a symbol of hope. We fought against the city of LA and a wealthy developer who wanted to put in 32 acres of warehouses in the last vast open space in downtown Los Angeles without any environmental review, without a consideration of a park alternative, without considering the impact on people of color. And today, that is a park. That happens to be my son juggling that ball. The second major area, as I said, is education. And we've worked on three major areas in the education context. First, I was the chair of the Los Angeles Unified School District Oversight Committee, School Bond Oversight Committee, from 2000 to 2005. We raised over $27 billion with a B to pass local bonds and secure matching state and federal bond funds to build schools and modernize existing schools in Los Angeles. And when we started building those schools, it was the first time in over 30 years that Los Angeles had built a high school. So President Obama has proposed $30 billion for school construction across the nation. We applaud that, but we had $27 billion in LA alone. So $30 billion is a drop in the bucket. It's a lot for LA, it's not a lot for the nation, but it deserves to be in a jobs program because that generated $27 billion of jobs in addition to creating the schools. The second area is the joint use of schools, pools, and parks, because no sooner did the schools start to be built. This is the Miguel Contreras High School in downtown Los Angeles, 3 blocks from my office, just a few blocks from where I grew up. And the school was built, and the first summer in the most park-poor assembly district in the state of California, LAUSD, the school district, would not open the school after school and on weekends and during the summer to the children who had no place to play, no place to swim, nothing else to do. And we mounted a campaign. This is a photograph from the LA Times, which captures the issue and the solution much more effectively than all the words that we could generate. And the school district ultimately opened that pool after school and on weekends. And the third area, which I'll talk about more, is enforcing physical education requirements in public schools. Last Thursday, there was a New York Times article about New York schools not enforcing physical education requirements, and it mentioned that 4 or 5 other states don't do it either. Surprisingly to me, because the New York Times usually gets things right, they left out California. Over half of the school districts in California do not enforce physical education requirements, requiring 20 minutes average in elementary school, 40 minutes average in middle and high schools. And we have now mounted 2 successful campaigns. One, persuading the Los Angeles Unified School District, the second largest in the nation with over 670,000 students, 94% of whom are children of color, 72% of whom qualify for free or reduced meals. That means they're poor. The LAUSD has voluntarily adopted an implementation plan, a physical education plan under both the education law and under the civil rights laws to provide that physical education. For us, physical education is a civil rights issue because if these children of color and low-income children, do not get physical education in school, they almost certainly do not get physical activity because they live in neighborhoods where there are no parks and where the schools are closed after school and on weekends. And the other component is that in Northern California, an attorney filed a lawsuit to require physical education enforcement, and the Court of Appeal held the law means what it says, 20 minutes average a day. That's not a guideline, that's not a good idea, that's not good policy, it's the law. Even under those circumstances, to our surprise, school districts are not enforcing the physical education laws. So we are extending the work of LAUSD to 3 other targeted school districts throughout California, and we are also monitoring compliance in LAUSD. To our surprise, we have received more money from foundations to monitor compliance with our campaign plan than we did to actually get the plan passed, because foundations will fund studies, but they're reluctant to fund action. The strategies, it's hard for you to read from there, but I'll go over them one by one. First of all, community organizing and coalition building. And this conference and this center is an example of that kind of organizing, because you're going to have to organize across demographics, across disciplines, across values, and bring people together to understand the values at stake in schools and parks. And we focus on schools and parks because they are the institutions that are most responsible for getting children physically active and eating well. Second, multidisciplinary research and analysis, what lawyers call gathering evidence, what we reframe as translating research into policy and law and change. This is our most recent publication. It's 150 pages long. It's available on the web. If you go to our website, www.cityprojectsca.org, there's a button there that says Map Justice. You click on that button, it will get you to that study, and it reflects 10 years of lessons learned. And as I say, we publish reports, we publish articles in referee journals and so on, but we don't measure success that way. We measure success by the number of smiles on children's faces who play in parks that did not exist before, the number of smiles on children's faces who have physical education, who did not have physical education before, but the research is hugely important to us. A third strategy is strategic media campaigns. And we used to rely almost exclusively on traditional media. As I say, the LA Times called the cornfield a heroic monument and a symbol of hope. The New York Times has called our work on the work in LA on revitalizing the Los Angeles River a best practice example of how cities across the nation can revitalize their urban areas. This is on the web now. KCET, the public broadcast television station in Los Angeles, did a 9-minute segment called Park Poor that includes our work. It's available on the web now if you go to our website and look for it in the blog. And you'll notice that there is Facebook, Twitter, LinkedIn links. So that's part of the way we spread our message. And I call it new media, but my sons say, why do you call it new media? It's the only media they rely on. Fourth is policy and legal advocacy outside the courts. As I mentioned, the campaign to persuade LAUSD to enforce the physical education requirements under the Education Code and the civil rights laws, they voluntarily agreed to do that. And it was because of the leadership of the district. I met with the superintendent, Ramon Cortines. We laid out our case. We had filed administrative complaints. Basically, we were saying, do you want to get married? And by the way, we have a gun. And Dr. Cortines said, it's unfortunate I have to do this with your thumb in my back, but I will enforce the physical education laws. And so that today, Robert Ross of the California Endowment has called that campaign a best practice example for school districts to enforce physical education laws, because it responds to each of the concerns that other schools or districts say. We don't have the money, we don't have time because of No Child Left Behind. LAUSD is doing it, the second largest school district in the nation. If LAUSD can do it, anybody can do it. We have a 30-page implementation plan. I thought it was going to be a memo from the superintendent to every principal saying, take the kids out for physical activity. It's 30 pages of plan. That's why you need lawyers. There is another lawyer here, as a matter of fact. Litigation. We don't call it litigation because foundations shy away from litigation. We call it access to justice through the courts. This is the LA River. That is a 40-acre site on the top and about a 20-acre site on the bottom. Today, Rio de Los Angeles State Park at Taylor Yard is located there on the 40-acre site. On the 20-acre site is a brand new high school. It was featured in President Obama's report on America's Great Outdoors. That's the good news. The bad news is the report is a very glossy discussion of the value of parks, but it ignores the fact that we had to file a lawsuit to create that park. It ignores the fact of the disparities based on race, color, national origin, income, and poverty in the United States, in access to parks, in access to physical education. It reflects the broader concerns of how do you enforce the civil rights laws in the 21st century, and paradoxically for us, it has become harder to enforce the civil rights laws with a black man in the White House than it was before he got there. The values at stake, and my time is up, so I'm very briefly summarize them. Professor Lerner mentioned that there are no 20 things that are not related. So we actually have identified about 20 different values, but we summarize them in these categories. One is human health and development. And as I say, it's not just about obesity. Physically fit students do better academically. That was the single most important argument to make to the education, to the school district. But it also includes the fact that children of color and low-income children, given adult supervised after-school programs, stay out of gangs, don't do drugs, and so on, and there's social science research to back that up. Second area is the conservation values of clean air, clean water, habitat protection. Third is cultural and spiritual values. Cardinal Roger Mahoney backed us up in the effort to create the park at the cornfield. Economic vitality. Civilian Conservation Corps and Public Works Administration created 8,000 parks, built 40,000 schools. Visits to the National Park Service increased 600% during that time. That is a best practice example for what the United States should be doing now in their stimulus programs. And finally, the cross-cutting values of equal justice, or in deference to Professor Lerner, social justice, democracy, livability for all. Thank you, that's all I have time for. There are more slides on the legal analysis, because the slides are pretty pictures, and you'll remember the pictures. You won't remember the legal analysis, but there is a deep legal analysis underlying all of this. Thank you very much.
Thank you, Robert. So I know you've been sitting for a long time, so it's time to ambulate. So when you ambulate to the microphone, please provide your name and your affiliation, and we have about 30 minutes for panel discussion.
Bruce Simons Morton, NICHD. So Mr. Garcia made an impassioned argument for enforcing the physical education requirements in California. And it's curious, isn't it? We're interested in youth, we're interested in schools, and here is physical education. Even though it's been under pressure, it has been in the curriculum in most states since John Dewey started school reform, right? And so you'd think this is a fantastic resource, and I think we all agree in the importance of physical activity and the potential of physical education. However, the rest of the panel are exercise physiologists who are only superior cousins to the physical educators, or cousins nonetheless, and didn't really talk much about physical education. And I bring this up because a long time ago, as a young investigator, assistant professor at the University of Texas School of Public Health, we had one of the first NIH-funded studies, a multi-level study to deal with pre-adolescent cardiovascular risk reduction, which includes physical education. And Russ was a consultant on this study, so he remembers this very well. And so we were interested in promoting physical activity through physical education. So the first thing we wanted to do was measure what was going on in these physical education classes. So I and some research assistants went out and we observed from some PE classes. And you know what was going on? Nothing. A typical class would be organized with all of the kids on one team lined up to hit the ball and all of the other kids out in the field waiting to receive one ball. If you were in the hitting line, you were lucky to hit the ball once. We thought, well, this can't really be true. So we developed the objective observational measure of what was going on in the amount of moderate to vigorous physical activity is going on in physical education. And lo and behold, we found that on average across these many schools, less than 10% of class time were the kids actually in moderate or vigorous physical activity. So in an hour's PE class, that's 6 minutes. We went on, so we intervened, and we were able to increase the percent of physical education class time that was devoted to moderate to vigorous physical activity, but it's not easy. It was a total struggle with these physical education instructors. But we were curious, could this really be the state of physical education, this incredible amount of resource that's devoted to physical activity and physical education in schools? We did a survey, we did a random sample of Texas elementary schools. We used our observational tool, and we observed some 50 schools. And we found that there was variability. There were a few good schools, very few. There were a few schools, outliers, where up to 45% of the class time was devoted to physical activity. But on average, it was about 10 to 15% of class time. So, you know, I bring this up because it's such a squandered resource, and I wonder, is it better now? Physical education, I know, is under pressure, but on the other hand, many policy documents, when they identify the high rates of obesity and the low levels of physical activity, they say, well, we need more PE. Do we need more PE?
Russ?
God, where to start? Well, first of all, let me say I love the work Robert's doing because we don't enforce the laws that are there now that I think could at least put kids in settings where they can be physically active, and as you noted, sometimes are the way we hope they would be, and often are not. Is it better now? I have a PhD student who's going to defend her dissertation in a couple of weeks, and what she did was directly observe kids in physical education and in recess in elementary schools. They were wearing accelerometers, and she coded when they walked into the PE setting and when they walked out. Same thing for recess. The kids were getting, not to pre-release her findings here, but the kids were got twice as much physical activity in recess as they did in physical education. So, you know, the question then is, what's that about? And, you know, I go way back with the field of physical education. There are fabulous programs out there, and I say all the time that if you saw one of them, you'd want your kid to have it. Unfortunately, that's not the norm. And the question then is, well, why isn't it the norm? And I think you have to understand something about the history of the field of physical education to kind of wrap your brain around that. But the field in the mid-20th century committed to a sports skill approach to the curriculum and has not, quite honestly, let go of that. Professional preparation programs still train physical education teachers to deliver that type of physical education. State laws still really are built around that approach to the curriculum. And while there has been change, and while I think there are some wonderful programs out there that really have committed to having kids be highly physically active while they're in that setting, as well as master some motor skills, enjoy themselves, have fun, be exposed to an environment in which the behavioral determinants of physical activity are attended to, as well as the sort of physical determinants of activity behavior. And that may sound like a mouthful, but it's all entirely possible, and it all happens. I mean, there are teachers out there that deliver that exposure. But the norm hasn't shifted nearly as much as it needs to. And, there was reference earlier to No Child Left Behind. Well, the Elementary and Secondary Education Act is up for reauthorization right now, as was mentioned. And there is a provision in the marked up bill right now that would require the schools to make public the physical activity, including physical education programming that they actually deliver. Right now, it's really not possible to know what's going on in the schools in most states. And this bill would not solve the whole problem, but if it passes in the form that it's currently marked up, it would at least shine the light of day on what's going on. And I think often that's the first step in the process of making large-scale social change. I'm not, for all my frustrations with physical education, I'm not willing to give up on it. As you said, Bruce, I think it is an enormous resource. It's one of the best hooks we've got right now. We've just got to figure out how to make it better.
Very briefly, yes, we do need physical education. We need quality physical education, and that's the rub. And California, for example, has standards to address the kind of concerns you mentioned. And there are proposals to revise even those standards to include not just to specify they have to be moderate to vigorous physical activity and what percentage of those 20 or 40 minutes. One, and two, you then need to enforce compliance. And I think the issue you ask is broader because I do consider the work we do on physical education as an extension of Brown versus Board of Education and the Civil Rights Movement for quality education. And that question is framed a lot now. Was Brown a victory or should there have been a different strategy? Equal funding for separate schools, for example. Yes, Brown v. Board was a victory, even though schools are now more segregated than they were before Brown, because it enforced the equal justice principles of the United States Constitution. And the states that now have physical education laws that are not being enforced, it sends a message that the children don't matter, the laws don't matter. And we are about to publish a report on the first year of monitoring, and that's the single most important thing parents and stakeholders said was we didn't know it was the law, we didn't know it was being flaunted. That sends the wrong message to our children. So yes, we need quality physical education.
And just to briefly add to that, I think most of the intervention studies out there have included physical education as one of those components. So we have a good handle on what works, and we just need to be better at disseminating how it gets there.
Thanks. Hi, Ellen Markowitz, Superstarters Consulting. First of all, I've been a sports-based youth development practitioner for at least 15 years. Back in New York City before coming to live in Charlottesville. And I remember when actually before PYD, so I'm older than I look, I can remember that. And we were doing sports-based work to try to help kids be better people and promoting the 5 C's. And I remember around 95, I heard about PYD and I was like, yeah, that's what we're doing. And so I wanted to share a couple of points in the spirit of bridges and translating and kind of the nuances and the complexities of each of these sessions in and of themselves, because I'm in this space, for example, but I don't do anything of what you folks mostly do in terms of my day-to-day type of work. And so a couple of things I just wanted to highlight or frame out. So there's been a long tradition of sports-based youth development kind of back with Don Hellison and his teaching personal and social responsibility model, and the first T, if you've heard of, teaching life skills through golf. So just that there has been kind of a strong tradition of using or promoting the 5 C's, using sports as a social change strategy. So we're kind of, coming at it from a lot of different points, but that there has been a lot of work in this area. And I also like to mention that there's a group based in New York City called Up to Us, Up the number 2 Us, which is a coalition of over 500 sports-based youth development organizations in the country. And so they're trying to be a voice and a lobbyist and a research center for a lot of this work. So for those that are interested in kind of the mapping the 5 C's into the sport environment, there is a group that's kind of leading that charge. The other thing that's interesting is that I'm in this arena, but there are just so many complexities when you talk about physical education, sport. Karin mentioned fitness, sport, school-based, out of school time, which is the space that I live in the most. Organized sports, which is what we hear about most in mainstream media, unorganized sports, recreation. So there's so many different facets. And so I'm just kind of even I'm overwhelmed when I've, read a lot of y'all's work. And but it's such an important thing. And what we do know is that kids learn better if they're physically active. And there's a ton of research on that. Shepard and Tremblay and all these folks, Australia, Canada, France. So I also would like to echo the point of we have this research, several studies, and what else can we be doing, or what else can we be thinking about to try to have more people understand and value and take action on that. If it's really about kids learning, and everyone wants kids to learn and be academically successful, that's what's important, very important in schools. How can we do more to take the research, the fabulous research, and push that so that more things happen? So continuing the work that you're doing. So thank you all.
I have an example.
Go for it.
I think you know Dan Gould. And so Dan and I are slowly working towards submitting a grant proposal where I got very interested in nature-based physical activities, so that may or may not involve sport per se, because we have these links with positive youth development and sport. We don't necessarily have it with overall physical activity model. So we're slowly working on a grant proposal that will get children in inner cities out into nature, and then also has a youth development component to it that would include things like conservationism, protecting the environment, but also talk about leadership and those sorts of things in more of a nature-based kind of setting. So that's one way that I see things coming together with a little bit broader scope to it.
So if I can just sort of provide a follow-up for Stewart, because you mentioned this briefly in your talk. There are a number of very creative programs now that incorporate academic learning and physical activity, but they can combine them in classroom settings where most teachers are not trained into how to implement physical activity effectively. So can you talk a little bit about the strategies that have been used in the classroom setting to do that?
We have evidence that you can successfully implement activity breaks into the classroom. They do provide activity, that they do reduce time off task, etc., which results in better learning outcomes. But we also have a lot of studies that show no effect. And I do think we need to be a little bit careful about being, it's great to be an advocate as well, but our evidence needs to keep improving in terms of academic performance and physical activity. In the fact that it doesn't impact learning sometimes is a good thing, that we can increase PE and not influence negatively the academic mission of the schools. PE wasn't invented to increase math scores, so we've got to be careful about how much we put that as a rationale for putting it in the schools. But I think we struggle with getting teachers to buy in with the in-class academic performance physical activity piece. If you present it in a simplistic way and saying, get your kids to jump up and down to count to 10, you don't get buy-in from teachers. So we really need to show very good educational outcomes related to these activity breaks. And I think we're just starting to get into those studies now. Bartholomew's at University of Texas is doing good work in that area. So it's compelling evidence, but I think sports programs need to adhere to many of the work that you've done in here about what constitutes a positive youth development program, because it really does depend on what sport, what population that you're looking at whether sport is a pro-social thing or not. And for many people, it's actually not a good experience. So we have to be mindful that we adhere to the positive youth development principles when we're engaging young kids in sports programs.
Yeah, I just want to add, that's one thing that when people think, oh, my kid does sports, so they're getting all this good stuff. Well, it doesn't happen by accident, and it has to be intentionally done. I totally agree with you. And also, just regarding physical education, I've lived in New York City a long time, and research shows that minority girls in urban environments have the least opportunities to participate in physical activity of any demographic segment. And, I go into schools, high school level, and the girls are sitting out. Say, what's wrong? What's wrong? And you know what? You'd never believe the scientific marvel, but girls in urban areas, they get their period every week. Every single week, they have their period because they don't want to participate because it's not, welcoming, inviting, supportive, et cetera. So anyway, thanks.
Hi, I'm Kristen Sakis. I'm on the City Council here in Charlottesville, and one of my fellow councilors, Holly Edwards, and I are here for most of the 2 days. So we're delighted to be here, and welcome to Charlottesville to those of you not from here. But I would like to take Mr. Garcia up on his challenge to translate, evidence-based research into terms that even elected officials can understand, I believe is the way that you put it. And Charlottesville, despite what you may see when you look around, has over 20% poverty level. Over 50% of our kids are on free and reduced lunches. Health outcomes are largely drawn on the lines of race and income, family income. And so I would like to ask each of the 4 or perhaps 5 of you, if you can just sort of offer me and other people like me 1 or 2 suggestions of things that we could do or implement or know or fund. We're a Let's Move city. We're redesigning playgrounds. We fund youth activities. We have to do with public safety as far as open spaces. What would you suggest, 1 or 2 things that would be kind of at the top of your list that we should know about or do?
Well, Robert, since it was addressed initially at you, we'll start at your end and work our way down.
I would recommend that you prioritize the areas with the greatest need, which, based on what you just said, are the low-income communities and communities of color. First of all, and second, that you have and implement a strategic plan for doing so. The National Academy of Science published last week or 2 weeks ago a report on health impact assessment, recommending that for every policy project program, such as what you're talking about, there be an analysis of the impact on health. And that's great news, and it gives specific recommendations of how you do the scope analysis, the need analysis, the impact analysis, the recommendations, and so on. So we support that. It's like an environmental impact assessment, except it's a health impact assessment. We were concerned that the Academy used only NEPA, the National Environmental Policy Act, as the legal tool for addressing these things. We believe the civil rights laws require the same kind of analysis for the reasons you said.
A bit of a tough question, but fair. I think another thing that you need to do to go in with that strategic assessment is also, once you've targeted where you're going to do some things, is do that formative assessment that I talked about and talk to the people who are from that area or that community and talk to them about what they want and what they would like to see happen. Because we could give you suggestions all day for different programs that are really nice programs or that kind of thing, but if that particular neighborhood or community isn't going to support that or isn't interested in it, then it might not fly as well. So I would also talk to the targeted population a little bit before getting too far in the planning process. And I've noticed too, particularly with this work in Grand Rapids, that if you can identify some collaborators to help do things with you, they can be any kind of agency. They can be people at the university, or they can be other community types of agencies. They're interested in doing things a lot of times. And if you can kind of ask around and figure that out. For example, one of the local universities in Grand Rapids in our project, they had a school of nursing and they wanted to implement an after-school program. So they teamed up with the Parks and Recs and they did that. And that, you know, they're not part of our main Michigan State team. They're someone in the community who wants to do a sustainable program and involve their nurses in the community. And so you can make a partnership like that I think also helps.
My suggestion would be to focus on school and district wellness committees. In terms of, there's a law now for like 2 or 3 years ago that mandated that all districts and schools have a wellness plan to receive funding for a free and reduced price lunch and other meals. Often there's no mandate to go further, and one success that I've had in my local community, sort of speaking locally, is really working with them to make a plan into action, evaluate their policy, how sound it is, and then infuse some coalitions within the community with the medical sector, the park and rec sector, to go into the schools and meet as part of the school wellness committee and pick 3 projects to work on during the year that actually implements their project, whether it be more than a token day of riding and walking to school. Actually do it for 6 months. Actually engage high school students in making an evaluation of the foods available at school and engage them in and this is in line with positive youth development, have them serve as advocates to make change to foster a more healthy eating environment. So I think that's something that I think is different that we haven't tried too much.
First of all, thank you for being here and for your question. To be very honest, I think you represent what should be in the crosshairs on this issue, which are the people who create policy at the community level. I'm going to give you either one idea or 256 ideas, depending on how you implement this. I'm involved with a national coalition that's developed a national physical activity plan. If you'll go to physicalactivityplan.org, you're going to see 256 recommendations organized in 8 societal sectors. A great many of those apply at the community level. And one of the challenges we have with physical activity behavior is, unfortunately, there is no magic bullet. I wish there was. I wish there was one initiative I could tell you is going to solve this problem. But physical activity behavior is complex. It occurs in a lot of settings, in a lot of different ways, and it plays out very differently in different kids. And I don't think there's going to be one simple solution to the problem. But I think we have learned enough about this behavior to make some good recommendations. And so if you'll go to that website, I think you'll find a few.
Okay, in the interest of time, we're going to need to wrap up. I think one of the things that we really didn't have much of a chance to delve into in the time frame that we had allotted to us is there's a movement right now, and there's a very large body of evidence that supports the notion that exercise is medicine. And there needs to be a balance between learning outcomes and health outcomes. And one of the unique things about Youth-Nex is that we have experts in both areas and we're trying to integrate. So hopefully over the course of the next couple of days, we'll have a chance to interact and talk a little bit more about how we can interface.